Welcome to the CMS Annual School Health Training presentation. Today we are going to present an overview of health-related information in the school setting. Hand washing with soap and water is the number one way to prevent illness. Hand sanitizer can be used in the absence of running water if hands are not visibly soiled. Student health and emergency contact cards are essential for each student to have on file. As you become aware of student health concerns or changes in parent contact information, please alert the front office for timely communication. Administration of medications may be necessary for some students. Medications can only be accepted by a school nurse and/or school nurse-trained medication administrator with an order from the medical provider. Please be aware that even over-the-counter products require a medical order. First aid kits with ointments, medicated pads, etc. may not be used on students. Please notify your school nurse 2 weeks in advance of field trips. It may be helpful to add this to your checkoff list when submitting a request for the field trip. Staff members must be trained to administer medications on field trips. This slide provides examples of appropriate health room visits. Please send a note including student name, health concern, and any other pertinent information. For example, a parent's recently updated phone number and/or point of contact. Please refer to CMS policy for incident reporting. Please rule out the need for bathroom breaks, water, and/or snacks if available prior to sending to the nurse's office. If the nurse is on campus, please consult before sending sick student home. In the event of an emergency, please provide the following information when calling for assistance: student name, location, type of emergency. This allows the nurse or first responder to bring the appropriate supplies or medication. Formulate a plan with your team members to provide privacy and a controlled environment during the emergency. Please remove students to another location.
We have provided a quick emergency information sheet for your reference. Please keep this visible in your classroom. Having a plan and this information will help you remain calm. All CMS schools are supplied with Narcan. Narcan is a life-saving treatment for opioid overdoses. Narcan will be stored with the AED in the front office. More information on Narcan can be found on the CMS My Talent website. First responders, please see your school nurse for additional training. Standard precautions are a way to protect yourself. 1. Wear gloves when coming into contact with bodily fluids. 2. Wash your hands after removing gloves. 3. Refer students or self to the school nurse if an exposure to blood or bodily fluids has occurred. Please see your financial secretary or treasurer for guidance on ordering personal protective equipment, PPE, from CMS Safety. This is an example of an emergency action plan. There are various forms depending on the diagnosis. This form provides steps to follow in the event of a health-related concern or emergency. Your school nurse will provide a copy to be maintained in the classroom, accessible to coverage staff. Please maintain confidentiality. Food, insect stings, medications, and latex are the most frequent causes of a severe allergic reaction. You may see the following symptoms: wheezing, trouble breathing, weak pulse, dizziness, pale or bluish skin, tightness of the throat, difficulty swallowing, swelling of face and/or hives. Allergic reactions are not always immediate. Be aware the signs and symptoms may occur hours after an exposure. EpiPen training is a required annual training video for all CMS staff. First responders will also receive additional training. Asthma is a narrowing of the airway causing difficulty breathing. If you suspect a student is having an asthma attack, please contact the school nurse or first responder. Do not have the student walk to the health room when having difficulty breathing. This is a general overview of diabetes. If there's a student with diabetes, there will be staff trained in diabetes care. Diabetes care includes monitoring blood sugar and insulin administration. Students are allowed to perform diabetes care as needed in any location at school. Diabetes treatment may utilize technology including an insulin pump, a continuous glucose monitoring device, CGM, and other devices. Your school nurse will communicate the devices used specific to the student. Low blood sugar is a medical emergency. This can be caused by too much insulin, increased activity or exercise, or missing a meal or snack. Symptoms can include dizziness, shaking, sweating, anxiety, hunger, blurry vision, weakness, fatigue, headache, behavior changes, pale skin, loss of consciousness, or seizure. Notify your school nurse, trained diabetes care team, and/or first responder.
Treatment of low blood sugar includes providing a fast-acting sugar such as juice, glucose tabs, or hard candy. If a student is unable to take anything by mouth because they are unconscious or having a seizure, call 911 and notify the school nurse, diabetes care team, and/or first responder. Please remember to include the student name, location, and description of the event. Hyperglycemia is a high blood sugar. This is not a medical emergency, but care must be provided. Signs of high blood sugar can include thirst, frequent urination, hunger, fatigue, irritability, and double vision. It is important to allow students with diabetes free use of the restroom. Encourage the student to drink water. Be aware of student's health plan in 504. Alert your nurse and/or diabetes care team when your student has a low blood sugar. Never allow a student who is feeling like they have a low blood sugar to walk alone. In the next section, we are going to provide information about seizures. Seizures occur when there is a misfiring of the electrical impulses of the brain. Some people will have a seizure once in their life, and others will have epilepsy, which causes multiple seizures. Seizures can be triggered for various reasons, including fever, illness, sleep deprivation, flickering lights, stress, and missed medications. Students who have a known seizure disorder will have an emergency action plan. Please be aware seizures are listed on the Quick Emergency Information Form. When a seizure occurs, after notifying your nurse and/or first responder, note the time and movements of the student. Provide privacy. Keep the student safe by removing furniture or objects that could cause injury. Place something soft, such as a jacket or blanket, under their head, and do not ever put anything in their mouth. Once the seizure is over, turn the student on their left side with mouth slightly pointed towards the floor to prevent choking in the event they vomit after the seizure. Call 911 if this is the first known seizure, lasting longer than the time stated on the emergency action plan, if the student is unresponsive after the seizure, if there is an injury, if emergency medication is administered. Always inform the parent. The Heimlich maneuver is performed when someone is choking. Proper technique can save a life. Always ask, "Are you choking?" before performing the Heimlich maneuver. Please reference the video listed in the next slide. This slide references videos required for all CMS staff. Please go to CMS My Talent to register and receive credit for reviewing required trainings. School health nurses are employees of the Mecklenburg County Health Department. You may receive encrypted emails from your school nurse's county email address. Please follow the prompts to accept these communications. This helps protect the privacy of our students and their families. In closing, thank you for your time and attention. Please reach out to your school nurse with any questions and concerns. And have a happy and healthy school year.